Hello, this is Dr. David Greene, CEO of the California Pain Network. The topic today is what you need to know about occipital nerve blocks. Occipital block is an injection of numbing medicine next to the occipital nerves, which are located on either side of the scalp, originating at the base of the neck. There is both a greater and a lesser occipital nerve, and either one can produce pain. These are only sensory nerves. There's no motor function at all. The injection is designed to stop the pain traveling along these nerves, which can lead to occipital neuralgia, cervicogenic headaches, or migraines. And the injections serve both the diagnostic and therapeutic purpose. The symptoms of occipital neuralgia include pain in one or both sides of the head. Typically, the scalp is tender, and it involves an aching, burning, throbbing pain. It may also be described as a sharp or electrical shock in the back part of the neck and head. Who benefits from an occipital block? Kind of just what we just talked about. Occipital neuralgia, those with pain on one side of the back of the head benefit the most. Migraine sufferers, over 50% can benefit. Cervicogenic headaches, by definition, is any headache caused by a problem in the neck, and it's typically one-sided. Cluster headaches, which are one of the most painful headache types, can also benefit. The procedure is very simple. It's quick. It can be done in the office in a few minutes. You don't need sedation. You don't need X-ray guidance. The pain doctor feels the point of maximal tenderness at the base of the skull and then moves the needle to inject both nerve areas with numbing medicine plus or minus steroids. Steroids not always administered. How well does the occipital block procedure work? For a procedure that's so quick and low risk, it works amazingly well. Usually patients get pain relief within minutes. For cervicogenic headaches, the response rate is 50 to 90% and averages 2.5 months. For cluster headaches, it's awesome. 85% response rate, can be anywhere from 4 weeks to 4 months. Occipital neuralgia, 85% response rate for 1 to 2 months. And then for migraines, it's 60% response rate with the relief averaging 4 to 5 weeks. And keep in mind, these can be repeated as necessary, right? When the pain relief wears off, what's next? You can repeat the procedure. You can do a pulsed radio frequency ablation, which is what you see here. The catheter goes in, it pulses thermal energy and deadens these nerves. Remember, they're not motor, they're only sensory, so it's not a big deal. There are no large studies available looking at radiofrequency ablation, but the small ones show that it works very well. The risks are absolutely minimal. There's a slight risk of bleeding, maybe infection. The needle is totally outside the spinal canal, so there's no risk of paralysis, and the nerves are not motor, right? So there's no risk of a CSF leak or spinal cord injury because the needles are completely outside of where any nerve or spinal cord is. The top pain management clinics in California are through the California Pain Network. There are several clinics throughout California, San Diego, up through OC, LA, Bakersfield, into San Francisco and Sacramento. Over 50 insurances are accepted. Over 25 treatment options are provided, including both medical and interventional treatments. Over 90% success rates are seen, and the pain doctors are board certified and award-winning. Visit us online at californiapainnetwork.com, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the California Pain Network. Your pain stops here.